Hey there, I hope you're doing well, and welcome to my video presentation on acoustic neuroma. So, before we get into what acoustic neuroma is, I want to mention uh, the format of how this video is going to go. So, for the beginning of this video, before I begin talking about acoustic neuroma, uh, I'm gonna show off a model. I'm gonna show off a model, so a visual example of how acoustic neuroma works that I have made. And then afterwards, I'm going to switch the video to a deep dive presentation talking about more of the facts, the causes, the differences between bilateral and unilateral uh, acoustic neuroma, some cures, and how to deal with acoustic neuroma. So let's get into it. So, acoustic neuroma, what is it? It is a non-cancerous tumor that develops on the main nerve leading to the inner ear to the brain. So this nerve is called the vestibular nerve, and the branches of this nerve directly affect hearing and balance. And so, as this tumor grows, the pressure of it can cause hearing loss, ringing in the ears, and problems with balance. Another name for acoustic neuroma that's a little bit harder to say that you will see in this presentation too is called vestibular schwannoma. I could be butchering that, but it's hard to say. Uh, but acoustic neuroma is a little bit better. And so what happens is we have these Szechuan's cells covering the acoustic neuroma, covering the vestibular nerve, and it develops a tumor. And so this tumor is slow growing, and as it slowly grows, it can cause problems uh, very quickly. The more it grows, the larger it gets, causing more pressure against the brain and can affect some vital functions of your brain. So, right here. So, here's your ear. This is what your ear looks like. You have all your pieces to it, and that is the acoustic neuroma, this tumor. You can see where it's wrapped around these nerves, connecting for balance and hearing, and your brainstem right there. But I feel like to see it flat like this in the information is really good to understand, but I feel like you need to see it visually. So that's where this comes in. I have created a model to visually show you how it affects everything. So here we go. Here is your ear. We have your ear, we have your ear canal, we have your brain sitting in your skull, and this red balloon right here is your acoustic neuroma. You see there's a hole behind it that blows air in it, so we can see the pressure between the brain and the parts of your ear that go right here. So what goes right there? A lot of pieces, but I dumbed it down to this, where you have your tegmental membrane right here. So your eardrum's right here. It's flat little disc right here. And then you have your ossicles. I painted them in different colors to show the different ossicles, the 3 little ossicle bones that make hearing and the vibrations worth it. And then you have your cochlea, the circular one right there. That little snail shell looking one right there with the tubes and everything. So where does this sit? It sits right here in your ear canal. So we're gonna put that in there. It's gonna sit right up against here. So you can see where we have it, and you can see the red right there of the acoustic neuroma. So let's see what happens as it slowly grows as time goes on. See, it's causing a lot of pressure right there. It's causing pressure between the brain and the structures of your ear that affect balance and hearing. So as it grows, all that pressure. That's not good. You see how far back that goes? Can't even stand into your ear canal. That is how the acoustic neuroma works, and that is how it affects your balance by slowly growing. But there's more than just that. As a simple rundown of how it works. As you see now, I take it and we'll go into the deep dive where you'll get more information on how this works and the differences that we have. Welcome to the deep dive portion on acoustic neuroma. In this section of the project, I'm going to discuss the differences in unilateral and bilateral acoustic neuroma. We're going to talk about the causes and risk factors. We're going to talk about the symptoms. We're going to talk about the complications, the diagnosis, and then lastly, the cures for acoustic neuroma. So let's get into it, and we're going to start with the differences between bilateral and unilateral. So we talked about what it is, so we're going to start with unilateral. So unilateral, meaning one, it only affects one ear. They account for approximately 8% of all tumors inside the skull. Approximately 1 out of every 100,000 individuals per year will develop a acoustic neuroma. So with this, also the symptoms may develop at any age, but they usually occur between the ages of 30 and 60 years of age. And most unilateral acoustic neuromas are not hereditary and occur sporadically. And moving on to bilateral, so bi meaning two. So this affects both hearing nerves and are usually associated with a genetic disorder called neurofibromatosis type 2, or NF2 for short, and to also make it a lot easier to say. So with this, half of affected individuals have inherited the disorder from an affected parent, and half seem to have a mutation for the first time in their family. So each child of an affected parent, this would give them a 50% chance of inheriting the disorder. So unlike those with the unilateral, individuals with NF2 usually develop symptoms in their teens or early adulthood. In addition to this, the patients of NF2 usually develop multiple brain and spinal cord related tumors. They can also develop tumors of the nerves that are important for swallowing, speech, eye and facial movements, and facial sensations. So, determining the best management of acoustic neuroma, as well as the additional nerve, brain, and spinal cord tumors, is more complicated than deciding how to treat a unilateral acoustic neuroma. And so further research is actually needed to determine the best treatment for individuals with NF2. For both of them, though, it is important to know that scientists believe that both form following the loss of the function of the gene on chromosome 22. So scientists believe that this particular gene on this chromosome 22 produces a protein that controls the growth of the Szechuan cells. So when this gene malfunctions, these cells, the cell growth is uncontrolled, resulting in a tumor. So scientists also think that this gene may be controlled with growth of other types of tumors. So NF2 patients, in those patients, the faulty gene on chromosome 22 is, like I said, inherited. So for individuals with unilateral, however, some scientists hypothesize that this gene somehow loses the ability to function properly. So let's move on to these causes and risk factors. So with the causes, the cause for acoustic neuromas can sometimes be linked to a problem with like I said, the gene on chromosome 22. Typically, this gene produces the tumor suppressor protein that helps control the growth of the cells covering the nerves. what I just stated previously. So, and experts don't know what causes the problems with this gene. Excuse me. And often there is no known cause for acoustic neuroma. The gene change is inherited in people with a rare disorder called NF2. And people with NF2 usually have the growth of tumors on the hearing and balance nerves on both sides of the head. And these tumors are known as the bilateral acoustic neuromas. Excuse me. So as I stated before, this gene, this mutated gene, usually causes this growth of these cells, resulting in a tumor. So, with that said, what are some risk factors? So, the only confirmed risk factor for acoustic neuromas is having a parent with the rare genetic disorder of NF2. However, the NF2 type only accounts for about 5% of acoustic neuroma cases. If you remember what we said, the unilateral, we said it's not necessarily inherent, but sporadic. So it just kind of pops up randomly. And so another hallmark characteristic of the NF2 is non-cancerous tumors on the balance nerves on both sides of the head, so the bilateral. So these tumors may also develop on other nerves. NF2 is also known as the autosomal dominant disorder. This means that this gene relates to the disorder and can be passed down by child by just one parent. So as I stated before, these children that have an affected parent, they have a 50-50 chance of actually inheriting it. Another known thing about NF2 is it's a genetic order, as I said, that predisposes individuals to develop non-cancerous, so benign tumors, primarily in the brain and spinal cord, but also the peripheral nerves. So this NF2 genetic disorder allows individuals to develop non-cancerous tumors. So how does this affect you? Well, moving on to the symptoms. So the symptoms of acoustic neuroma are often easy to miss and actually may take years to develop. So these symptoms may occur because of the tumor's effect on the hearing and the balance nerves. So the tumor also can put pressure on the nearby nerves controlling facial muscles known as, the facial nerve, and sensation known as trigeminal nerve. Blood vessels or brain structures can also be affected by acoustic neuroma. So as the tumor grows, it may be more likely to cause more noticeable or worse symptoms. And these symptoms are included right here. So we have hearing loss, which which gradually changes over the months to years. The hearing, in rare cases, hearing loss can be sudden. Hearing loss can usually occur on one side, or if it's worsened, on the other side. You have ringing in the ear, known as tinnitus, loss of balance or not feeling steady. You can have dizziness, the facial numbness, and very rarely weakness or loss of muscle movement. Rarely an acoustic neuroma may grow large enough to compress the brainstem and can become life-threatening. So, what are the complications? So, acoustic neuroma may cause permanent complications, including the hearing loss, the facial numbness and weakness, the balance problems, and the ringing in the ear. So, a large tumor may press on the brainstem. That could happen and occasionally prevent the flow of the cerebral spinal fluid between the brain and the spinal cord. So, this fluid can build up in your head and this can increase the pressure inside the skull, and that is not good. So what are some treatments? Well, the diagnosis, let's get into that first. So the unilateral Uh, uh, you usually have unilateral asymmetric hearing loss, or or a tinnitus, and loss of balance and dizziness are early signs of acoustic neuroma. Unfortunately, early detection of the tumor is sometimes difficult because the symptoms may not be subtle and may not appear in the in the beginning stages of the growth. So, you really don't know any of those symptoms until, unfortunately, it grows big enough to cause those problems, causing those symptoms. Also, so hearing loss, you can have hearing loss, dizziness, and tinnitus. As I said, are the most common of the symptoms, and many middle and inner ear problems. The important one here is that unilateral and asymmetric symptoms are the worrisome ones. So, a hearing test to diagnose yourself is a hearing test known as audiometry. This test is conducted by a hearing specialist called what we have learned, an audiologist. So during the test, the sounds are directed to one ear at a time. The audiologist presents a range of sounds of various tones, and the patient indicates each time you hear the sound. Each tone is presented at faint levels to find out when you can barely hear. And the audiologist also may present various words to test your hearing. And we can also do imaging. So we do an MRI or a CT scan. So the MRI is a magnetic resonance imaging with contrast dye, usually used to diagnose acoustic neuroma. This imaging test can detect tumors as small as 1 to 2 millimeters in diameter. So if the MRI is not available, or you can't have the MRI scan, which also is very more expensive than the CT scan, you can get the CT scan can be available to you. However, the CT scans can miss the small tumors. So, moving on. So, what are some cures? Well, early diagnosis of acoustic neuroma is key to preventing its serious consequences. There are some options for managing the acoustic neuroma. So you can have surgical removal, radiation, or through observation. So we mentioned surgery. You know, that's you may need surgery to remove an acoustic neuroma, especially if the tumor is continuing to grow or is very large or causing these symptoms. The surgery technique depends on the size of the tumor, your hearing status, and other factors. So, the goal of surgery is to remove the tumor and preserve the facial nerve to prevent paralysis of muscles in your face. So, removing the entire tumor may not always be possible. For example, if the tumor is too close to important parts of the brain or the facial nerve, only part of the tumor may be removed. So, surgery for acoustic neuroma is performed under general anesthesia. Surgery involves removing the tumor through the inner ear or through a window in your skull. So, and sometimes removing the tumor may actually worsen the symptoms in the hearing, balance, or facial nerves are irritated or damaged during this operation. So, hearing may be lost on the side where the surgery is performed, and balance is usually affected temporarily. So, you can have many complications through this too, like leaking of the fluid that surrounds your brain spinal cord, known as what I said earlier, the cerebral spinal fluid, and leaking may happen through the wound. You can have hearing loss, facial weakness or numbness, ringing in the ear, balance problems, and a persistent headache. Rarely infection or the cerebral spinal fluid. Uh, you can develop meningitis, and very rarely a stroke or brain bleeding. So when we move on to radiation therapy, there are several types of this radiation therapy that can be used to treat this. Excuse me. We have stereotactic radiosurgery. So this is a type of radiation therapy, and it can be treated to treat acoustic neuroma. So it's often used if the tumor is small or less than 2.5 centimeters in diameter. Uh, Radiation therapy can also be used if you're older adult, or you can tolerate surgery for if you cannot tolerate surgery for health reasons. The goal of this is to stop the growth of the tumor and preserve the facial nerves and possibly preserve the hearing. So it takes weeks, months, or years before you even notice the effects of the surgery. And your healthcare team really wants to stay with you and monitor the progress and following up with these image studies and hearing tests. So the risk of the radiosurgery includes the hearing loss, ringing in the ear, facial weakness or numbness, balance problems, and continued tumor growth. So, the next one we have is fractionated stereotactic radiotherapy. And so what this does, it delivers a small dose of radiation to the tumor over several sessions. So SRT for short is done to slow the growth of the tumor without damaging the surrounding brain tissue. And then we also have proton beam therapy. And so this type of radiation therapy uses high energy beams of these positively charged particles known as protons. So it's a high beam of protons, and this proton beam are delivered to the affected area in a targeted dose to treat the tumors. So this type of therapy lowers the radiation exposure to the surrounding area. So the other cure we have is just observation. You and your healthcare team, may decide to monitor the acoustic neuroma. If it's small and if it isn't growing, or if it's growing slowly, it's good to just have people observe this. This may be an option if the acoustic neuroma causes fewer or no symptoms. Monitoring also may be recommended if you're an older adult, or if you're not a good candidate, or more aggressive treatment. And while being monitored, you need regular imaging and hearing tests, usually every 6 to 12 months, and these tests can determine whether the tumor is growing and how quickly. If the screens show the tumor is growing, or if the tumor causes uh, worse symptoms or other problems, then you probably need to go and have surgery or the radiation. And that is the deep dive on acoustic neuroma. I thank you, and as you can see, here are the citations for all the studying. So, as I said, thank you for watching. I hope you enjoyed the presentation. Have a great day.